बहुत बड़ा इफेक्ट रहता है, विषय रहता है कि इसको कैसे हैंडल किया जाए। दोनों को ही काउंसलिंग करके और उनको सही समाधान और रास्ता बतलाया जाता है अपार्ट फ्रॉम द ट्रीटमेंट। तो बहुत अच्छा विषय, बड़ा इंटरेस्टिंग विषय है। हम समझते हैं कि हम सब लोग बड़ा ज्ञानवर्धन होगा आप लोगों के मार्गदर्शन से। आप सबका बहुत बहुत अभिनंदन करते हुए विषय के लिए केवल इतना ही कहना है कि प्रिवेलिंग सिचुएशन है, ये एक सामान्य सी नहीं है। पहले कभी ऐसी क्लिनिकल उसमें आती नहीं थी, आज से 30-40-50 साल पहले, लेकिन आज ये हर दूसरे तीसरे कपल के मामले में ये चीज आती है। और शायद अब बोल्डली आने लगी, शाइनेस भी नहीं रह गई है, बतलाते हैं क्या है क्या नहीं। तो नेचुरली आप लोगों को क्योंकि डे टू डे की ओपीडी में हैंडल करना होता है, तो आपके अनुभवों से हम लोग लाभ उठाएंगे। इन्हीं शब्दों से आते हैं आपका पुनः एक बार स्वागत करते हुए और आपका विशेष रूप से अभिनंदन करते हुए कि आपके द्वारा इस सीरीज पर लाखों लाख लोगों को लाभ मिल रहा है, जो प्रेजेंट है, जो बाद में विजिट करते हैं। तो ये बहुत ही उपयोगी सीरीज है और हम सबका इससे बहुत बड़ा सहयोग मिलता है आपके जरिए और पूरे मानव जात की सेवा है। मैं अच्छा है कि मेल के बारे में भी कुछ सोचा जा रहा है और आप लोगों के सहयोग को धन्यवाद करते हुए आगे बढ़ने के लिए पवन शर्मा इससे पुनः निवेदन। नमस्कार।
बहुत बहुत आभार आपका अग्निहोत्री सर, बहुत बहुत आभार। मैं अब निशान जी नमस्कार। मैं अब डॉक्टर कामिनी धीमान जी को सादर आह्वान करता हूं उनके विचारों के लिए।
नमस्कार पवन सर, अग्निहोत्री जी, Ramveer sir, today's speaker Dr. Radhika, and all the participants in continuation of infertility series webinars. First we started male infertility, anatomical physiological factors के बाद हमने लिया है this problem, क्योंकि जब हम ओपीडी में बैठते हैं, स्पेशली इनफर्टिलिटी पेशेंट्स ट्रीट करते हैं, जब हम देखते हैं सारी रिपोर्ट्स भी ठीक है, सिम एनालिसिस ठीक है, तो कई बार पेशेंट को पूछना पड़ता है कि व्हाट इज द इश्यू एंड कोई ऐसा प्रॉब्लम तो नहीं होती। तब जाकर फीमेल, जैसे सर ने बोला कि सो मेनी टाइम्स फीमेल्स आर रिवीलिंग दैट दे आर हैविंग सच टाइप ऑफ इश्यूज, and after that we get to know that this couple is having infertility due to this issue. So in such cases we have to treat the cases. So we thought that today it should be discussed in the webinar series of infertility. So directly I would like to invite Dr. Radhika, and then we will take up the discussion and question answer session. Dr. Radhika, over to you. Dr. Radhika is from Vaidyaratnam Kottakkal. Welcome, Dr. Radhika. Over to you.
Thank you so much, ma'am. A very warm good evening to one and all. Most respected Dr. Pawan Sharma sir, convener and host of AYUSH SAMRIDDHI, respected Professor Vineet Agnihotri sir, respected Professor Vishnu P. Sharma sir, respected Professor Ramveer sir, and respected Professor Kamini Dhiman ma'am, who is the HOD and Department of PTSR, All India Institute, New Delhi, and my teachers, all the dignitaries, and my dear doctors. First of all, thank you for giving me this opportunity to present in AYUSH Samriddhi International Conference Series. So today, with my limited knowledge, I will be explaining about the erectile dysfunction. So, ma'am, can I share my slide?
Yeah, sure.
And I hope it's visible.
Yes, that's visible.
Okay. So as Professor Agnihotri sir explained, one of the most prevailing issues that has been there in our society is erectile dysfunction. So we know that erectile dysfunction is very easy to be told, like it is just a inability to achieve or maintain an erection adequate for satisfactory sexual intercourse. But actually, the most prevailing problem is that when you think from the side of a patient or from a person, it is one of the most difficult condition, and it is not as easy as you explain. So according to the American Psychiatric Association 2013 DSM-5 defines erectile dysfunction as a recurrent inability to achieve or maintain an erection during the sexual activity. The symptoms must persist for at least 6 months The symptoms must occur during 75 to 100% of sexual activity. The symptoms must cause significant distress. The dysfunction cannot be better explained by other factors such as medical condition, medication, or relationship stress. So first of all, before going into erection or before going to erectile dysfunction, let us just brush up on the anatomy of penis. So here, I'm just brushing up. This is the erectile tissue, that is the corpus cavernosum. We have the tunica albuginea, it is covering the corpus cavernosa, and you have the trabeculase and the cavernosal spaces and the artery. And also below to that, you can see the urethra, which is being circulated by the corpus spongiosum. A normal male sexual function, what are the requirements for it? An intact libido, and not only tumescence, it needs detumescence as well, which is the relaxation as well, and the ability to achieve and maintain a penile erection, and the ejaculation, that is the parasympathetic nerves, S2 to S4, that mediate the erection, and for ejaculation and detumescence, you need sympathetic nerves, that is from T11 to L2. So these are the main requirements for a male sexual function. So before we understand what is erectile dysfunction, first we need to understand what is erection. Then only we will get to know what is erectile dysfunction, where the problem is arising. So there have been a lot of classes regarding the physiology of erection, but let me just brush up this for you. It is actually the stimuluses, that is the tactile stimulus, thought stimulus, sight stimulus, everything that stimulates the parasympathetic nerve, that is from S2 to S4. These are the pelvic nerves. So these pelvic nerves, when these get stimulated, these releases acetylcholine, that is ACH. And this neurotransmitter, it binds on the receptors in the epithelium of the blood vessels of the corpus cavernosum. As it stimulates these blood vessels, there is a trigger of the intracellular pathway that happens. And this pathway helps in conversion of the arginine into nitric oxide and citrulline. And what does this nitric oxide does? This nitric oxide will stimulate the smooth muscles, and stimulate the guanyl cyclase in the smooth muscles. So what happens to this guanyl cyclase? What is the purpose of this guanyl cyclase? This converts the GTP into cyclical GMP, that is the guanosine monophosphate. And this guanosine monophosphate helps in vasodilatation as well as relaxes the smooth muscles. So when there is relaxation of the smooth muscle, that is the erectile tissue expands. So once there is an expansion of the erectile tissue, this squeezes, as we had seen that the veins that drain the blood, this gets squeezed, and this prevents the blood drainage, and this maintains an engorgement of the penis. So this is what happens, and this is how erection actually happens, the physiology of erection. So once we understand this physiology of erection, it will be easy to understand what is this erectile dysfunction. So basically, this erectile dysfunction can be caused by a number of factors. But what happens here? Here the main problem that happens is the phosphodiesterase, PDE5. Actually, this what happens is this will come and change the cGMP into the GMP. So when their conversion of this GMP occurs, what happens? The cGMP is lost. The cGMP is not active or not produced. So when there is no cGMP, there is no erection. This is what happens in an erectile dysfunction. So this is the normal pathway of erection, whatever I have told you right now. Sexual impulse will be there, and the neurotransmitter acetylcholine will be produced, and this will help in the release of nitric oxide and chemical substrates, and this will in turn help in the smooth muscle relaxation and tumescence, or the erection happens where there will be venous occlusion, and rigidity and erection happens. So how does this ejaculation happen? Let us see how the ejaculation happens. When the parasympathetic stimulation reaches a threshold, this acts on the cerebral cortex and inhibits the parasympathetic nerves and stimulates the sympathetic nerves. So when there is sympathetic nerve stimulation, that is from the T12 to L2, these receptors will bind on the inferior mesenteric ganglion, release the neuroepinephrine, and this release receptors to bind to the epididymis and the norepinephrine is formed. And this contracts the vas difference. So what happens if it contracts the vas difference? The sperms are ejaculated, or the sperms are squeezed out. And there is another stimulation to the seminal vesicle, where the semen is also poured or squeezed out. Okay, when this both happens, there is another there is a problem called as retroejaculation. Sometimes this reflex into the bladder happens. So to prevent that reflex, there is already an adrenergic fibers from the inferior mesenteric ganglion that acts on the intraurethral sphincter. And when these act on the intraurethral sphincter, the sphincter just goes off, or the sphincter just stretches, and this stricture helps to prevent the reflex. And this is how the ejaculation happens. So that is how erection and ejaculation happens. Now let's see what are the types of erectile dysfunctions. So there is primary and there is secondary erectile dysfunctions. Primary means from the first itself, the person is having this problem of erectile dysfunction. And the secondary is the person had a normal function, and then later on in some point of his life, he gets into this erectile dysfunction. And there is something called as situational male erectile dysfunction, wherein a male is unable to have coitus in certain circumstances. Okay, and unlike premature ejaculation, the erectile dysfunction is very common in older than in younger men, wherein premature ejaculation is seen more in younger men than in older men. So let's see the causes of this. So there can be psychogenic causes, vasculogenic causes, systemic diseases, neurogenic, hormonal, drug-induced. So the most important, very important part is called as the psychogenic one, because most of the cases that we get in our OPDs are mostly psychogenic. We know that almost all the diseases are psychosomatic diseases, wherein the brain plays a big role. So the brain plays a key role in triggering the series of physical events that cause an erection, starting from the feeling of sexual excitement. A number of things can interfere with the sexual feelings and cause or worsen the erectile dysfunction, like whether the person is having a depression, anxiety, stress, or other mental condition, or there is some relationship problems which is due to stress, or there is poor communication between the partners, or other concerns, or there is some performance anxiety. Very important is this performance anxiety, because once the person has an erectile dysfunction, then the next time also he is always thinking that whether he will have an erectile dysfunction or not. So with that thought itself, what happens? Erectile dysfunction naturally happens. So this performance anxiety is a very important part. So let's see the vasculogenic causes. So vasculogenic causes are the arterial or the cavernosus, that is atherosclerosis, which has an endothelial dysfunction, hypertension or trauma. All these cause endothelial dysfunction and reduce the blood supply to the penis. Then the neurogenic causes, like the stroke, etc. Here what happens? The parasympathetic and the sympathetic nerve system are affected, and this hampers all the rest of the process of erection. And the other systemic diseases like old age, diabetes mellitus, chronic renal failure, coronary artery disease, dyslipidemia, etc. What does this do? This damages the endothelial dysfunction. And this endothelial dysfunction creates erectile dysfunction by reducing the nitric oxide, increasing the oxidative stress, and increasing the local vasoconstrictive mediators. So these are the main causes or the major problems that can cause erectile dysfunction. Another major thing is hormonal, that is hypogonadism and hyperprolactinemia. Both these reduces the testosterone and causes ED. Drug-induced, like antihypertensives, when used for a longer period, antidepressants, some of the antidepressants, anti-androgens, alcohol abuse, cigarette smoking, everything cause a reduce in the dopamine level and reduce the testosterone as well, and thus results in ED. So medicines that cause ED are beta blockers, statins, diuretics, antidepressants, antipsychotics, etc. Calcium channel blockers and ACE inhibitors rarely cause ED. So let's see how can we differentiate between a psychogenic and an organic one? This is very, 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 very important, because until and unless we don't understand whether it is a psychogenic problem, whether it is an organic problem, it is very difficult to treat. So here we can see how we can differentiate it. Okay. So the psychogenic part, it will be a sudden onset. Maybe it will be a situational one, or it can arrive because of some kind of an issue or some kind of a problem. So organic one, gradual onset will be there. And it occurs in all the situations, whether the patient is non-stressed, whether the patient is stressed, all the time this organic can occur. And there will be nocturnal erections, and there will be normal waking. So this can happen in the psychogenic. But in organic, there will be reduced or absent waking and nocturnal erections. Natural means naturally nocturnal erections happen, but in organic, it doesn't happen. In psychogenic, there will be normal erection with masturbation, but in organic, even with masturbation, there is no erection happening. And in psychogenic, tumescence present, and here lack of tumescence is there. And psychogenic, mostly it is because of relationship problems or some kind of a major life events, sometimes a death of some family members or any kind of life events, and anxiety, fear, depression, all these can cause psychogenic. Whereas in organic, there will be some kind of underlying problem, systemic issues, that is cardiovascular, endocrinal, neurological, operational, radiotherapies, trauma, medications, smoking, alcohol, etc. So by this, you will understand the difference between a psychogenic one and an organic one. So when you get a difference, it is very easy to put on to understand where we have to act. So these are the risk factors of erectile dysfunction. We have already discussed about the causes. The same are coming in the risk factors. So the main problem that I have noticed in our clinics is loss of physical activity and obesity and useless thoughts like depression, anxiety, performance anxiety, and high cholesterol level, which is very much increasing nowadays, and diabetes and smoking. So how we will now we have understood how to differentiate between psychogenic and organic one. So now let's see how to assess the patient. So here we need a thorough history, and this thorough history should be in such a way that you should have a good rapport with the patient. Until and unless you don't have a good rapport with the patient, he is not going to disclose everything to you. So once you make a rapport with the patient, you can ask questions which will help in understanding his history. The questions can be, has there been a previous period of normal function? Has the failure occurred with more than one partner? Does erection occur during foreplay? Does erection occur on waking or in response to masturbation? Is there any evidence of alcohol, smoking, or drug abuse? And are there possible effects of any medications? So understanding these things can help us assess the patient's problem, underlying root cause. For this help, we have a questionnaire. In this questionnaire, there are 5 questions that has been put on, wherein how to rate your confidence, etc. All these 5 questions you can ask, which has been given by the International Index of Erectile Functioning Scoring, wherein by analyzing the scores, we can understand where the patient is, means like which degree the patient is having in the erectile dysfunction. Like 22 to 25, no erectile dysfunction, 17 to 21 marks, mild erectile dysfunction, 12 to 16 marks, mild to moderate, 8 to 11 marks, moderate, and 5 to 7 is severe erectile dysfunction. So this is very useful for understanding the degree of erectile dysfunction. So when it comes to examination, you have to check the blood pressure, peripheral pulses, testis size and consistency. One of the major things that each doctor should do in their clinic, because every time when a patient comes, we will be like asking them whether the size of the testis is okay or not. The patient says, yes, it is okay. But until and unless you don't examine the size and consistency of the testis, we are unaware about the condition of the testis. So this can be done with the help with his wife or with any other male doctors if you are a female doctor. Secondary sexual characters should be seen to understand the level of testosterone, and if there is any Peyronie's plagues or phimosis, we need to examine that. Coming into the investigations, blood investigations, we can do serum testosterone, serum prolactin, and sugars, that is diabetes, if there is any diabetes or not, lipids, thyroid dysfunctions. And there are some tests for erection which can be seen in REM sleep. Okay, so this is snap gauge and this strain gauge. This is to understand the nocturnal penile tumescence. So here basically what happens is a small rubber band. It's a band. It's a band is put on the penis and while the patient is sleeping to understand whether the erection is happening or not. So coming into the treatment part, so I'll be just brushing about the modern part wherein the modern therapies are used, and later on we will see about the Ayurvedic part. So the general measures, psychosexual therapies, drug therapy, vacuum devices, and surgical implants are the major line of treatment. So this is the ED treatment algorithm that the modern people use when they get a ED patient. So the first line will be lifestyle changes and hormonal issues. Second line will be oral medication and counseling. And still it is not getting better, then means third line, that is penile injections or vacuum devices can be used. And if nothing is going to work for the patient, then the fourth line and the last resort is implantations and vascular surgeries. So the general things that need to be taken care in Ayurvedic as well as in modern is smoking cessation, reduce alcohol, weight loss, and go for exercise. And psychosexual therapy. This is a very important area where we should concentrate and where we should work on to help reduce ED. Because most of the ED that we get in our clinics is mostly because of psychosexual problems. So there will be performance anxiety, as I mentioned before. Sensate focused exercises are present. Relationship counseling, cognitive behavioral therapies, solution-focused brief therapy, hypnotherapy, and Smriti meditation. So I'm not aware whether you know about Smriti meditation. Smriti meditation is something that the Kottakkal College, Aryaveda College has been brought about. It's a method of meditation wherein to understand the root cause, why this has occurred, and correcting it. So this is very, very useful when it comes to psychosexual therapies. The drugs for ED, the main drug that is being used and the familiar one for us is phosphodiesterase type 5 inhibitors. As I mentioned before, this phosphodiesterase type 5 inhibitors helps or correct ED. So some of the PDE5 inhibitors are very commonly Viagra, Cialis, and Levitra. So these three are the very common inhibitors, PDE5 inhibitors that are available in the market. So Viagra, it should be given 1 hour before the sexual activity. There is a 4 to 6 hours of window, and absorption is delayed by fatty meals. All the absorptions are delayed by fatty meals. And the Cialis, it is given 30 minutes before sexual activity. It is having a 36-hour window. And Levitra is also 30 to 60 minutes before sexual activity, and there is a 4 to 6 hours window. So how does this PDE5 inhibitors work? So basically, I'll just go to the previous slides so that I can help explain that. So when it comes to PDE5 inhibitors, as I told you, when this PDE5 is present, this will cause the cGMP to form into GMP. So there is no cGMP present. So this PDE5 inhibitors are used to inhibit this PDE5, wherein the cyclical cGMP is not being transformed to change to GMP, so that there will be enough amount of cGMP and erection happens naturally. So that is how PDE5 works. Okay. And this PDE5 inhibitors does not have any effect on the penis in the absence of sexual stimulation when the concentration of nitric oxide and cyclic GMP are low. So there is a lot of side effects for this PDE5 inhibitors, that is facial flushing, headache, nasal congestion, dizziness, dyspepsia, visual disturbances, priapism, and non-arthritic anterior ischemic optic neuropathy, which is very much seen when it is used in a long time. Then there is intracavernosal injections. that is alprostadil 5 to 40 mcg, which is given and which is having side effects on the penoscrotal pain, hematoma, fibrosis at the injection site, etc. And this is a vaso-intestinal peptide, that is papaverine. And there is an intraurethral one, that is alprostadil muse, which is a pellet, which is inserted with an applicator, massage penis to aid absorption, which is again having a side effect of penile pain. Then vacuum devices are also available very widely, and which can be used, which should not be used for more than 30 minutes. And there is a constricting ring at the base of the penis, and this will cause cyanosis, edema, and it will cause coldness to the penis. Wherein, why this is happening? Because the blood trapped in the intracorporeal or the extracorporeal compartments of the penis causes the cyanosis and edema. Okay. Then, as the last resort, there is penile prosthesis. This is a 3-piece inflatable prosthesis with abdominal reservoir. You can see here there is a saline reservoir, there is a pump, and there is a cylinder. So this can cause, this is an implantation process, and this can cause infections, and this might cause the erectile tissue, that is the corpora cavernosa, and it causes erosions and extrusion, and there can be mechanical failures as well. So these are the modern treatments that they do usually for erectile dysfunction. Now coming into Ayurvedic interventions, what I have always felt is that even though they use a lot of the modern medicine techniques or the modern medicine medicines that directly affect on the PGE5 inhibitors, we don't have much effect on the PGE5 inhibitors, but we still have a lot to do in erectile dysfunction. So basically, erectile dysfunction is understood as clybia, that is impotence. So a man who is unable to perform sexual intercourse, being powerless, helpless, or the inability to carry out sexual activities is called as clybia. So the main issue is not able to attain or keep the sufficient rigidity or firmness of erection. So these are the definitions of clybia that is told in our classics. So coming into the etiology, there is a lot of factors. As we saw, there is psychosexual factors, a lot of factors, organic factors, etc. Here, when it comes to Ayurveda, we basically treat through the gut. So the food items and the behavioral aspects that leads to impotency is given more stress in Ayurveda. So the food items which are kshara and katu, kashaya, lavana rasa, all these can cause shukragna and avrishya properties. These cause shukragna and avrishya properties or shoshana of shukra. Charaka has specifically told that amla and katu vipaka are shukrahara and shukranashaka. And viruddhahara, we know that viruddhahara is not good for our body. So viruddhahara should also be avoided. So when we are treating a patient of ED, we should be very specific and we should very much stress on the factor of avoiding kshara, lavana, katu, kashaya, and amla aharas in the food that we take. So coming into the lakshanas, there is samanya lakshana and there is vishesh lakshana. So I'll first explain about samanya lakshana. Samanya lakshana is linga shaithilya, that is flaccidity of the penis even after psychic or physical stimulation. Mlana shishnada, that is rigidity, lack of rigidity. Nirbija, absence of sperms, or mokha sankalpa cheshta, that is futile sexual activity. These are the samanya lakshanas that we can see in clybia. So Shushruta Acharya and Bhava Prakasha have explained different types of clybia, that is sahaja and sthira shukra nimittaja clybia, manasa clybia, saumya clybia, medra rogaja clybia, shukra kshayaja clybia, dhadu kshaya or pittaja clybia. I will be explaining each. And Charaka Acharya has told jaraja clybia, dwaja bangaja clybia, bijo upaghataja clybia, and shukra kshayaja clybia. So let's just see what all these are. So first one is dwaja bhangaja clybia or medra rogaja clybia. That is any change in the structure or integrity of a part or organ is called as bhanga. We know that. And dwaja means it is understood as penis. So initially, dwaja bhangaja clibia produces inflammation and ulcer in the genital organs associated with pain and in turn affects the sexual intercourse. We know there are a lot of infections and inflammations that happens in the penis. So these can affect the sexual intercourse or the erection. In due course of time, when the ulcer penetrates into deeper and deeper tissues, it destructs the musculature, vessels, and nerves, leading to permanent erectile dysfunction. It is characterized by involvement of penile organ suggestive of local affliction of penis, be it infectious or wounds, and the lakshanas of this type resembles venereal disease, that is Ubadamsha. Now coming into Bijopakadaja. Bijopakadaja, the word itself gives us the idea that is Bija Nasha, that is reduced Bija or diminution of the Bija. The semen gets vitiated and diminished in quantity. Chakrapani explained that it is due to the Prakrita Vayu Kshaya, means the Vayu, the main problem is here is the Vata, leading to deficient production of Bija, thus leading to the presentation of Bijopakadaja clibia. The Nidanas are Ruksha, again giving importance to the Ahara, Viruddhahara, Ruksha, Ajirna Bhojana, Anashana, that is fasting, Ativyavaya, excessive physical activity or excessive sexual activity. All these causes derangement to the Vata and ultimately causing into Shukra Kshaya. And also the Manasika Karana, that is Chinta, Shoka, Krodha, Rajoguna, all these can cause erectile dysfunction or clibia. Then next is Jaraja clibia. We know that as we age, there is depletion of Rasadi Dadus. So we know that Shukra is a cumulative of all the Rasadi Dadus. So when there is depletion of Rasadi Dadus, which naturally occurs in old age or due to intake of Avrishya Ahara, clibia occurs. So there will be reduced testosterone and the sexual dysfunction is more common. And then next one is Kshayaja or Shukra Kshayaja clibia, where there is again the diminution of semen. Charaka explained due to Nidana is like Ruksha and Napana. Again, our more stress is given on the food that we intake or the psychological factor that is being stressed here. So when there is excess sexual activity, when there is Chinta, Shoka, Krodha, etc., can cause Kshayaja or Shukra Kshayaja clibia. Then Sahaja clibia. This is very important because this can occur congenitally also. When there is a provocation of Vata dosha, particularly the Vyana and Apana, occurring due to Vishamasthiti, assumed during Samyoga. So the parents are also responsible for the clibia, Sahaja clibia in a person. This leads to improper Samyoga of Shukra and Shonita, leading to improper development of sexual organs. Thus, there is a defect and causes clibia. Then Manasika clibia is the Chinta, Shoga, Baya, Krodha, etc. The psychogenic impotence. This may be due to disinterest towards the female partner, mistrust, forced marriage, unattractiveness to the female, etc. Then Saumya Dhatu, that is again the diminution of semen due to excessive intake of diet, and Shukra Stambhaja, that is mental agitation and following celibacy, which results in not focusing towards sexual gratification. Then Virya Vahisira Chedaja, that is Marma Chedaja, that is injury to the sexual organ, like any trauma to the pelvis or any trauma to the blood vessels and the nerves supplying to the penis. Excessive usage can also cause this clibia. Then Sadhya Sadhya of clibia. Acharya Charaka has mentioned that clibia occur due to Dvajabhanga, Janmajata, and Kshayajanya are Kashtasadhya, and clibia as such is Asadhya. Clibia occurred due to amputation of penis or testis is incurable. That is very evident. So we are now coming into the treatment aspect. So whenever we are treating a patient or treating a person with erectile dysfunction, we should follow certain things, or we should have a insight, or we should speak this to the patient, that not only the medicine, because all the people think that only the medicine is required for the treatment, but no, the medicine, a good psych, that is a good mind, a wholesome diet, And a good lifestyle or a daily routine is very, very, very important for 100% result of any disease. And when it comes to erectile dysfunction, especially. So the treatment, we know that there is Brahmana and Langhana treatment. So Brahmana finds a fair application in chlamydia. The system focuses on cause rather than symptoms. So the cause for chlamydia will be different for different people. So we need to see what is the cause and then treat the patient. The treatments are person-specific rather than disorder-specific. Thus, the appropriate choice of therapy should be selected considering the causative factor and after a thorough evaluation of the patient, which is sometimes missed. So we need to keep in mind. It depends upon the patient to patient. You can't say that, yes, this medicine, this is very good for erectile dysfunction. You give this medicine, you'll get 100% result. No, you have to see the condition of the patient. You have to see what the problem for the patient is facing, and then you have to decide about the treatments. So some of the principles that we can carry out for chlamydia chikitsa is being told, that is dravya chikitsa, that is drug therapy, adravya or manasika chikitsa, and pathyacharana. Charaka has stressed upon the factor of purification therapy, vrishya yogas, and patyahara. So the purification therapy means sneha yukta virechana, and basti, and vrishya yogas or vrishya dravyas, adravya vrishyas, that is psychotherapy, and patyahara. So we know that for pitta, it is virechana. So virechana is the best treatment for vitiated pitta dosha. Shukravaha srodo dushti chikitsa should also be done because the srotas is also affected in chlamydia. And Charaka has explained that in Niruha Basti, it is Shukra Bala Prada. So conducting Niruha Bastis are very good for the chlamydia. Anuvasana Bastis are Prajakara, and it corrects the Sheena Shukra, and it is Virya Vritti. So Anuvasana Basti and Niruha Basti makes the best combo for erectile dysfunction. So the course of treatment, this is a treatment protocol that we conduct in our hospital, and we have received good results by conducting all these treatment protocols. Okay. So first we will carry out the Snehapana. Before Snehapana, we need to do the Deepana Pachana. Only after that, we should conduct Snehapana. And Snehapana, you can use Kalyanaka Krida, Palasarpes, or Dadimadi Krida. Okay, which is Mudavatanilomna. And Virechanam with Avipatti Churna can be done, Pittahara. And Anuvasana Vasti with Dhanvantara can be done in an Arohana style, that is in an increasing manner. And Vachikarana Vasti, Mushka Pijudarana. Mushka Pijudarana is applying Pichu on the area or on the penis and the associated area. Bala Ashwagandhadi Taila can be carried out for Mushka Pijudarana. Dhanvantaram can be carried for Mushka Pijudarana. Kshira Bala can be used for Shiro Abhyanga or Shirodhara. Panchagandhadik Kshiram can be used for Shirodhara. Kati Avagaham can be done because it improves the circulation, Kati Avagaham. And Uttaravasti, which is one of the main treatments that we perform for erectile dysfunction. So Vajikarna Vasti, you can use Brihatyadi Panchamula, Shali, Goduma, Yava, Marsha, Shashtika, and Changala Kshira, water, and if possible, if you are using a goat testicles, it is very good because it gives good result, and the Shiram is prepared, and the Sita 30 grams is added, and 1 egg is added, and it is blended together, and this Vasti is performed. Other Bastis that can be used is Jivantyadi Anuvasana, and Vrishyatama Basti Yoga, and Shukra Janana Mahakashayas and Prajastabana Mahakashayas can be used for Basti, for the Kshira Paga. Okay. Then coming into male Uttaravasti. This is one of the basic or the important treatment that we perform mainly for erectile dysfunction as well as premature ejaculation. So here, this is a protocol, or this is a segment that I practice in our hospital. So we do 3 Uttaravastis in Ahoratra, means in 24 hours, we perform 3 Uttaravastis. And this can be done for 3 days. So 3 into 3 days can be done. But according to the condition of the patient, because sometimes what happens is the patient is very weak. The patient is having less bala or mano bala is less. In that cases, you can do just perform 3 Uttaravastis in Ahoratra and stop it. This can be done in between Anuvasana and Niruha Basti, wherein when you are planning for a Uttara Basti, first you can put up with a Yoga Basti pattern, and then you can incorporate this Uttara Basti into that Yoga Basti. This helps in increasing the blood flow and secretion of active enzymes required for erection. The gritas or the tailas that we use basically are Vastyamaya and the Grida, which is one of the best medicine that I have ever had. I have got a very good result with Vastyamaya and the Grida. Dadi Madi Grida, both are Mudhavata Anulomana, and Sahasradi Taila because Sira Granthi. So taking that concept, we can put Sahasradi Taila, and as a Brahmana, we can go for Dhanvantara Taila as well. The dosages, I usually practice 15 to 30 ml according to the condition of the patient, and if the patient can take more, then up to 40 ml can be given. But whenever you are doing a male Uttaravasti, you should be very, very, very careful about the aseptic precautions. Otherwise, you are introducing iatrogenic infections. So please be careful about the aseptic precautions. And the instruments that we usually use for this male Uttaravasti is red rubber catheter, which is sized 4 or 6. That is very small one. Or else the best method or the tension-free method is infant feeding tube. Indications of male Uttaravasti. There are a lot of indications. Out of that, for Clybia, it is Kashta Shukra, Dushta Shukra, Shukra Nasha, and Clybia. Nasya. This is a very important part because nowadays we know that modern people are using gonadotropin intranasal sprays. So why can't we use our Nasya, which is having a very potent action on stimulating the hypothalamus? It will help in that hypothalamus pituitary cycle or the pituitary that pathway. So this can in turn stimulate the hypothalamus and the endocrinal dysfunctions, because whether it is because of any psychological issue also, or if it is because of reduced testosterone, Nasya plays a very vital role. Anutaila, Gogrida, or Kalyanaka Grida. These are the common tailas that we use. So this can be used for Nasya. Now coming into Vajikarana Chikitsa. There are majorly 5 things that you need to understand in Vajikarana Chikitsa. One is Shukra Janana. That is dravyas which enhance the seminal secretion or production. It is also known as Shukrala dravyas. That is Ashwagandha. That is, it helps in the secretion or the production, Jananam. So production, that is Ashwagandha, Musali, Mudgaparni, Mashaparni, etc. And Shukra Pravartaga, which helps in the seminal flow or ejaculation. So that is milk, Masha, Amalaki, Baladaga. These are some examples only. Shukra Rechana means helps in proper ejaculation of the semen. That is Brihati Bala, Kantakari. Shukra Shodhana, that helps in purifying a semen. This is very important because most of this, I'm going out of the topic, most of the male infertilities happens because of the improper or non-purified or lack of proper semen, or the quality of the semen or the sperm is lost. In that cases, you can use Shukra Shodhana dravyas and Shukra Stambhaga dravyas, the dravyas which promote the retention capacity of a male sperm during sexual intercourse, which is very much useful for our Clybia. Example, Jati Phala. So let us understand what is Vrishya and what is Vajikarna. Because every time we hear about Vajikarna, Vrishya, everything seems to be same. But actually, it is very much different. Vajikarna is different and Vrishya is different. Vachi means horse. Vrisha means bull. There is a small difference between these two animals. Horse is a symbol of sexual vigor, whereas bull, which is not as sexually potent as horse, but it is sexually potent, but can have multiple orgasms and can procreate offsprings better than a horse. So when it comes to procreation, or when it comes to bringing an offspring, you have to follow Vrishya. And when it comes to erectile dysfunction, premature ejaculation, or loss of sexual, sexual stimulus, all these things you can use Vajikarana. So Vrishya means Vajikarana is sexual vigor, and Vrishya is focused on procreation. So the some of the medicines or some of the drugs that we can use as Vajikarana and Vrishya. Vajikarana, it is Kupilu, Jyotishmati, Jatamanchi, Masha, Kapikachu, etc. And Vrishya, it is Gokshura. Gokshura is a very good Vrishya. Shankapushpi, again, it is a very good Vrishya. Pippali, Erandamula. So these are the medicines. So now let's come into the one of the combination that we mainly practice in our clinic is Gokshiradi Modakam. It is very simple to make. If you can, it is very beneficial even for improving the sperm quality and also the motility. So Gokshura, Ikshura, Ashwagandha, Shatavari, Musali, Vanari Bija, Yashti Madhu, Nagabala, Bala. All these 9 drugs are taken and made it into a powder. And these medicines are cooked in milk, and they are cooked and concentrated in the milk, and also ghee is added, and then it is roasted in the ghee. Then later on, the Kokilaksha is powdered. Okay, Kokilaksha is taken as the same quantity. Kokilaksha is taken, is powdered separately, and it is roasted separately in the ghee. And then next procedure is Khanda Sita, which is made into a syrup. So you cannot give this if the patient is having diabetes. So Khanda Sita, it is made into a syrup in a wide vessel, and the previously prepared Kshira Paka and the Kokilaksha powder roasted in the ghee, both are put in this, and it is made it into a Paka. Again, fried till it becomes Vataka Rupa or a granule form. So this is what Gokshiradi Motaka is. Then next, the internal medicines. These are some of the internal medicines that you are well aware of, and you might be practicing this. So these can be given according to the conditions of the patient. Out of this, I would like to just describe few. Bala Ashwagandhadi Taila for Mushka Piju is having a very good result. And also Dhanvantara Savyas, 101 Savya or 41 Avarti Savya is very good for improving the erectile dysfunction. Balasarpis, Shilajatu Rasayana, Vastyamayanda Gagrada, Dadima Digrada, Chiruvillu Adikashaya, all these are very much important when it comes to Clybia. And these are some of the useful dravyas, that is Ashwagandha, Bala, Atmagupta, Gokshura, Masha, Ikshuraga, Musali, Jeevandi, Guduchi, Amalaki, etc., which are very much useful in this condition. And also, whenever you are treating a erectile dysfunction condition, Kshira and Grita is a must. You should ask the patient to have Kshira every day, and you should ask the patient to take Go-Grita or any medicated ghee along with his food or as such. So I think that's it about erectile dysfunction. So with my limited knowledge, I think I have explained erectile dysfunction. So once again, I thank the AYUSH Samriddhi International Conference Series for giving me this opportunity, and especially my special thanks to Professor Kamini Dhiman ma'am, because she has been a great support to me, and she has always helped me in performing this seminar as well. Thank you so much, ma'am, and thank you everyone for listening patiently. Thank you.
Excellent, very nice presentation. Your slides were excellent, your presentation was excellent, full of energy, full of knowledge. I think all the participants have gained a lot much. So we will over to the discussion and questions. First of all, I would like to invite Ramvi sir if he is here in the session. Sir, we would like to listen to you, your opinion about this. And participants can pose their question or can ask the questions.
बहुत ही अच्छा स्पीच और प्रेजेंटेशन रहा। मैं डॉक्टर रामवीर शर्मा जी को सादर आमंत्रित करता हूँ। भाई जी प्रणाम, दर्शन दीजिए।
दर्शन हुए। सभी को नमस्कार। बहुत ही अच्छा प्रेजेंटेशन रहा। मुझे लगता है इसमें कुछ मॉडर्न या आयुर्वेद को कहने के लिए कुछ बाकी नहीं रहा है। मैं जो प्रेजेंट कर रही थी मैम, उनको मैं बहुत बहुत बधाई देता हूँ, इतना अच्छा प्रेजेंटेशन दिया उन्होंने। आचार्यों ने जो चीज कही हुई है वो मॉडर्न मेरे ख्याल से बाद में कहा है। आचार्यों ने जिस चीज कही है वो मॉडर्न बाद में उसको कॉपी करता है। निश्चित ही उन्होंने थोड़ा डिटेल में मॉडर्न ने कहा है। आयुर्वेद में भाव प्रकाश ने बहुत अच्छी बात की है। उन्होंने 7 प्रकार के जो कहे हैं, तो उसमें सब कंट्रोल अपने सारे के सारे इसमें वो आ जाते हैं, समावेशित हो जाते हैं। जिसमें मानसिक है, पित्तज है, वीर क्षयज है, रोग क्षयज है, शुक्र स्तंभजन्य है, सहज है, स्वस्थकृत है। मैडम ने इनको सातों को उन्होंने डिटेल में बताया। और इसी तरह से चरक ने भी जो 4 तरह के कहे हैं, बीजोपघातज कहे हैं, उसी तरह ध्वजभंग जो कहा गया है। तो उनके जितने भी पॉजिटिव फैक्टर है, ये जो 4 कारण बताए, उनके भी अलग पॉजिटिव फैक्टर है। उनको भी ट्रीटमेंट करने के लिए भी अलग अलग ट्रीटमेंट जैसे निदान प्रयोजन के अनुसार किया गया है, वैसे ही किया जाता है। जहां तक मेरा मानना है, मैम ने 2 बड़ी बड़ी अच्छी बात की थी। इसमें जो इरेक्शन का जो फिजियोलॉजी है, उसको अगर हम नहीं समझ पाएंगे तब तक उसकी पैथोलॉजी को नहीं समझेंगे। तो फिजियोलॉजी अगर समझ ली तो पैथोलॉजी होगी, और पैथोलॉजी के बाद में संप्राप्ति, विघटन, वेव चिकित्सा। जैसे नाइट्रस ऑक्साइड का सीक्रेशन नहीं हो रहा है, एपिथेलियम में उसके अंदर अपने जो कैवर्नोसा अपने स्पंज मसल्स हैं, स्पंजियोसा, उनके अंदर अगर एपिथेलियम उसको रिसेप्ट नहीं कर पा रही है, तो उसके अंदर वासोडाइलेटेशन नहीं होगा और इरेक्शन नहीं होगा। तो नाइट्रस ऑक्साइड कौन सी मेडिसिन से इसमें कई फैक्टर काम करते हैं। जैसे नर्व्स के द्वारा भी होता है, न्यूरल अपने स्टिमुलेशन भी होता है, हार्मोनल स्टिमुलेशन भी होता है, और लोकल अपने जैसे उन्होंने कहा बताया अपने मैडम ने न्यूरो ट्रांसमीटर्स। तो न्यूरो ट्रांसमीटर्स का अलग रोल है, नर्व्स का अलग रोल है, मसल्स का अलग रोल है, ब्लड सर्कुलेशन का अलग अलग अपने अपने रोल है। इसी तरह से मेडिसिन को भी अपने अंदर भी अपने इस तरह से अपने डिवाइड किया जा सकता है। आयुर्वेद के अनुसार भी विभिन्न प्रकार के उन्होंने बाजीकरण कहे हुए हैं। तो अलग अलग बाजीकरण को अलग अलग तरह से, जैसे साइकोसोमेटिक डिसऑर्डर हैं, तो साइकोसोमेटिक डिसऑर्डर्स के अंदर अपने काउंसलिंग के साथ साथ में एक चीज बहुत अच्छी बात की, सेक्स इज नॉट ए साइंस, दैट इज द आर्ट। अगर सेक्सुअल एक्ट है उसको बार बार अगर रिपीट करते हैं, तो आर्ट जिस तरह से बनाते हैं उस तरह से पेशेंट को बताएं कि पहली आर्ट आपकी खराब होगी, दूसरी आर्ट खराब होगी, बार बार बनाएंगे तो आपकी आर्ट परफेक्ट होती जाएगी। तो पेशेंट को कॉन्फिडेंस बढ़ाना, चाहे मेडिसिन के द्वारा पढ़ाएं या आश्वासन के द्वारा पढ़ाएं। तो मैडम ने जो बताई, अद्रव्यभूत चिकित्सा और द्रव्यभूत चिकित्सा। तो जो साइकोसोमेटिक मोस्टली जो अपने ऑर्गेनिक डिसऑर्डर्स नहीं होते हैं, उनमें साइकोलॉजी, मेरे मानना है या मेरे के अपने क्लिनिक में जो पेशेंट आते हैं, ज्यादातर साइकोलॉजिकल ही पेशेंट आते हैं। उनको काउंसलिंग के साथ साथ में मेडिसिन, हम जो अपने वेद्य रसायन कही गई है, जो ट्रैंकुलाइजर का काम करती हैं, या अपने जिस तरह से अपने मेडिटेशन काम करता है, उस तरह से अगर को डील करते हैं, तो साइकोसोमेटिक जो अपने इरेक्टाइल डिसऑर्डर है, उसमें ज्यादा रिजल्ट मिलता है। और अब कई तरह के रिजल्ट हैं, जैसे मेडिसिन बताया अपने डॉक्टर ने बताया, जैसे नक्श भूमिका भी देते हैं स्टिमुलेशन के लिए, अश्वगंधा भी देते हैं, कौच भी देते हैं, सालम पंजा भी देते हैं, गोक्षुर भी देते हैं। निश्चित ही इनके अलग अलग रोल हैं। गोक्षुर का हर एक जगह नहीं दे सकते। गोक्षुर को जहाँ पे ओलिगोस्पर्मिया हो रहा है या सीमेन की कमी हो रही है, वहां पे देते हैं। वहीं कपकक्षु दे रहे हैं, तो कपकक्षु का हुआ इरेक्टाइल डिसऑर्डर के अंदर अच्छा काम करेगा। और विष्णु का सबसे बढ़िया काम करता है टेस्टोस्टेरोन पर अपने शुंठी। तो जिंजर का प्रयोग किया था, शुंठी का प्रयोग किया था। इनका सभी का ही बाजीकरण को इनको क्लासिफाइड करके, कौन सा क्लासिफिकेशन के बाद में कौन सा नाइट्रस ऑक्साइड पे काम करता है, कौन सा एसिटाइल कोलिन पे काम करता है, कौन सा न्यूरो ट्रांसमीटर्स पे अच्छे काम करते हैं, इस तरह से अपने क्लासिफिकेशन करके जो अगर ट्रीटमेंट किया जाता है, निश्चित ही दोषों के अनुसार मान लें या फिर स्रोतों के अनुसार समझ लें, तो इनको अच्छी तरह से अगर क्लासिफाइड करके करेंगे। जैसे साइकोसोमेटिक डिसऑर्डर का पेशेंट है, तो उसके अंदर अपने काउंसलिंग के साथ साथ में वेद रसायन है, जटामासी है, और जो आदमी की जो स्ट्रेस है उसको कम करती है, डिप्रेशन को कम करती है। इस तरह की मेडिसिन का प्रयोग करेंगे तो उसमें अच्छा रिजल्ट मिलेगा। न्यूरोलॉजिकल डिसऑर्डर है, जहाँ पे नर्वाइन टॉनिक का प्रयोग करेंगे, जैसे नक्श भूमिका का प्रयोग करेंगे, कोच का प्रयोग करेंगे, सालम पंजा का प्रयोग करेंगे, और अकरकरा का प्रयोग करेंगे। अकरकरा को शक्कर स्तंभ में सबसे इरेक्शन के लिए सबसे अच्छा अकरकरा का प्रयोग बताएगा। तो मेडिसिन को अपने इसको इस तरह से क्लासीफाइड, 2 तरह की, जैसे शुक्र को वृद्धि करनी है तो उसके अंदर 3 तरह के शुक्र के बताए, तो उसमें शुक्र को वृद्धि तो सौम्य चीज औषधियों का प्रयोग किया जाएगा। और जहाँ इरेक्टाइल डिसऑर्डर है, वहां पर सौम्य औषधियों की जगह पे वहां पर उष्ण औषधियों का प्रयोग किया जाएगा, वहां से, क्योंकि बात को अपने को समन करना है। इरेक्टाइल डिसऑर्डर के अंदर मेरा मानना है कि बात का समन करना जरूरी है। यहाँ पे बात की वृद्धि रह रही। कई बच्चे ऐसे होते हैं, अगर दृश्य का प्रयोग कर रहे हैं, तो कई दिनों से जो ज्यादा एक्सेसिव स्टिमुलेशन होता है, प्रीमेच्योर इजैकुलेशन का कारण बनता है। इसी तरह से इरेक्टाइल डिसऑर्डर का भी कारण बनता है, क्लीवेसी बनती है। इस तरह से अपनी क्लासिफिकेशन भी मेडिसिन, उत्तरवस्ती का निश्चित कार्य है, उत्तरवस्ती का कहाँ तक कार्य है, क्या वो अपने न्यूरोट्रांसमीटर पे काम करती है, क्या वो अपने लोकल काम करती है, वासोडाइलेशन का ही काम करती है? तो इन चीजों को अपने क्लासिफाइड करके अगर ट्रीटमेंट करेंगे तो मेरे ख्याल से बहुत ज्यादा अच्छा रिजल्ट मिल पाएगा। और किस तरह का पेशेंट है क्लासिफाइड, जैसे 7 तरह के बताए, 4 प्रकार के बताए, आयुर्वेद के इनके अंदर ही सभी समावेश हो जाते हैं। मॉडर्न साइंस के अनुसार जितनी चीजें बताई उनका पॉजिटिव फैक्टर वहां पे भी कम करेंगे तो रिजल्ट मिलेगा। अलग अलग एल्कलॉइड्स, अलग अलग मेडिसिन के अंदर अलग अलग एल्कलॉइड्स होते हैं, उस तरह से ही वो उस तरह से काम करते हैं, जिसको अपनी वीर्य कहते हैं। तो वीर्य के अनुसार, रस के अनुसार उसका प्रयोग करेंगे तो बहुत अच्छा काम करेगा। मैडम ने बहुत अच्छा प्रेजेंटेशन किया है, उसको मैं फिर से एक बार बधाई देता हूँ। थैंक यू वेरी मच, मेरे लिए जानकारी के लिए बहुत अच्छा सेशन था। थैंक यू।
थैंक यू सर। आप ठीक हो गए हैं? बिल्कुल।
मैं आप ठीक हूँ। आज प्लेटलेट्स मेरी 120 हो गई है, इसलिए मैं बोल पा रहा हूँ।
जी
वाह,
जी जी
शाबाश,
बिल्कुल।
बहुत
परसों
बढ़िया।
परसों परसों हॉस्पिटल से डिस्चार्ज होके आ
बहुत बढ़िया बढ़िया।
गया। जी मैम, जी मैम।
डॉक्टर पवन कुछ पूछना चाह रहे थे आप? पवन जी, आप खुद पूछना चाहें तो पूछ सकते हैं। पवन।
गुड इवनिंग मैम। सबसे पहले
गुड इवनिंग।
तो सभी को मेरा नमस्कार, सादर चरण स्पर्श। और मैम को बहुत बहुत धन्यवाद। इतना सुप्रभ सेशन और इतना एनर्जेटिक सेशन फर्स्ट टाइम मैंने सुना। मैम मेरा एक ही क्वेश्चन था, जाति फिलहाल का जो रोल रहता ना, वो इंटरकोर्स से कितना टाइम पहले लेना है और कितना डोज में लेना है?
Sir, actually, Jati Phala, I used to prescribe it as in a powder form, and we used to mix it with honey or Kalyanaga Grita. We used to mix it because we use very less rasa dravyas in South India. So we basically mix it with Kalyanaga Grita or Dadi Madi Grita, and we prescribe it 1 teaspoon with 1 teaspoon of Grita in the morning and night. 7 to 10 days before sexual intercourse, because we give it for 7 to 10 days and we get a result after 10 days. Means we need minimum 7 to 10 days of time for getting the result.
थैंक यू मैम।
Anybody else want to ask if question, then can ask, or want to add anything, can add.
जी मैम, एक ऐड और करूंगा मैं थोड़ा सा।
जी जी जी।
जैसा अभी बात हुई थी, कई जगह पे हम लोग मेडिसिन का प्रयोग करते हैं। अभी डाक्शन होता है, जाति फल का प्रयोग निश्चित ही जाति फल स्तंभ रूप में काम करता है, स्टिमुलेशन के रूप में भी काम करता है। इसी तरह चक्कर का कुछ गम है और एजियन का प्रयोग किया गया है। एक चीज मैं भूल जाऊंगा, अगर पवन जी मेरे को डांटेंगे बाद में, बड़ा अच्छा प्रयोग करते हैं। भंगा का प्रयोग शोक स्तंभ के रूप में और इरेक्टाइल डिस्फंक्शन के रूप में किया जाता है। इसी तरह से आइफेन का प्रयोग किया जाता था, जो उपवेश में आते हैं, इनका भी प्रयोग किया जाता है। हमारे कई औषधियों के अंदर इनका प्रयोग किया गया है, जैसे भंगा और आइफेन का, जहाँ पे अपने उसको सोरस की भावना दी गई। समुद्र फैन का प्रयोग है, खदिर का प्रयोग है, जो स्तंभन का काम करते हैं। उनका स्टिमुलेशन और स्तंभन दोनों का अलग अलग है। स्टिमुलेशन एक अलग प्रयोग करते हैं और स्तंभन के लिए अलग। तो भंगा और आइफेन का भी प्रयोग इसमें किए जाते हैं। तो अलग अलग मेडिसिन का किस तरह से आचरण, वायीकरण और व्यर्थ का प्रयोग किया गया है, उनको अपने इस तरह से यूज किया जा सकता है, पेशेंट टू पेशेंट, किस तरह का पेशेंट। थैंक यू।
सुधा, तुम्हारा क्वेश्चन था लास्ट वीक, यू कैन आस्क योर क्वेश्चन। Sudha, Dr. Sudha.
Yes, ma'am. Yes, ma'am.
You can ask your
Namaste, ma'am.
question.
Namaste, ma'am. Good evening, everybody. Thank you, ma'am. Actually, my question was regarding this erectile dysfunction. A patient I am treating with the complaint of erectile dysfunction along with the epididymal cyst. And after giving the detailed history of that patient, I found the chronic debility of that patient. He is a farmer, so the due to excessive exertion and malnutrition, she gradually developed erectile dysfunction. And after getting the result in Doppler ultrasound of scrotum, I found epididymal cyst. And that patient was treated with Karma Vasti along with Uttar Vasti. Now the epididymal cyst is minimized, but the symptoms regarding the erectile dysfunctions is not much improved. And one thing in that patient, I found before starting the treatment, I found the agiospermia, sorry, oligospermia. And now the semen analysis, all parameters are completely okay, but the symptoms like erectile dysfunction is as it is. It's not developing. The result I am not getting. In spite of giving lots of Brunghan Dravya like Satavari, Ashwagandha, and 3 to 4 episodes of this Uttarvasti, still the patient is the same in same situations regarding the erectile dysfunction. So in this case, what I can manage? So please suggest me, ma'am.
Dr. Sudha, actually in this case, you can, what I feel is that you can give for Mutrala, that is Punarnavasava can be a good option, and also Drakshadi Kashaya along with Chandraprabha tablet will be giving a good effect in correcting the erectile dysfunction if you are majorly looking for this factor. And also Dadimadi Grida will be of utmost help in this condition, along with some counseling can also help correct the erectile dysfunction. That is what I feel, madam.
Okay, ma'am. Actually, ma'am, I have already given the Draksha preparations. Draksha is the Drakshavin, it's running. And not yet I have given this Dadimadikruta, what you have said. So I will try that medicine, ma'am. Ma'am, thank you so much, ma'am. Any Panchakarma therapy I can add, ma'am, in this case?
Ma'am, here if you can add Anuvasana Vasti with Sahajaradi Taila in Arohana Matra along with Dhanvantaram also, it would be beneficial. And you can give that for almost 10 or 15 days as a full course. And also Pushka Pichu and Kati Avagaha will give good result, ma'am.
मैम
like
मैम
how to
एक मिनट
apply?
ऐड कर देता हूँ मैम, एक ऐड कर देता हूँ इसमें। इसमें आप उसको मूलाधार बंद की प्रैक्टिस के लिए कहिए।
ओके सर।
मूलाधार बंद करते हैं जो मूलाधार बंद उसमें योगा में करते हैं, उसको कहिए। और ज्यादातर लेबर क्लास के जो लोग होते हैं, ऐसा देखा गया है कि उनके अंदर इतनी ज्यादा कमी नहीं पड़ती, टेस्टोस्टेरोन की कमी नहीं पड़ती है। धूप में जो काम करते हैं, विटामिन डी जिनके अंदर रहती है, उनके अंदर टेस्टोस्टेरोन की कमी नहीं रहती। तो बहुत कम लोगों में ऐसा होता है कि इरेक्टाइल डिस्फंक्शन अपने जो है इनमें हो, मालन्यूट्रिशन की वजह से होता है। तो मूलाधार बंद का उनको प्रैक्टिस कराएंगे तो निश्चित ही उसमें रिजल्ट मिलेगा। और काउंसलिंग की मैडम ने बताया, तो काउंसलिंग के लिए जरूरी है कि आपके ऊपर उसका फेद होना चाहिए पेशेंट का। तो फेद कैसे जागृत होगा? तो पेशेंट का कंप्लीट उसका एग्जामिनेशन करिए। आप एग्जामिनेशन करेगा, उसका फेथ बनेगा, आप जो काउंसलिंग करेंगे उसका रिजल्ट मिलेगा। अदरवाइज काउंसलिंग करते रहिए, उसका रिजल्ट रजिस्ट्री नहीं मिलेगा जब तक फेथ नहीं बनता पेशेंट। इसलिए एग्जामिन द पेशेंट प्रॉपर्ली, देन मूलाधार बंद, प्रेस्क्राइब द मूलाधार बंद, निश्चित ही रिजल्ट मिलेगा।
Okay, sir. Definitely, I will do that. Ma'am, I wanted to know the musk pichu जो बोला आपने, how to apply that, ma'am?
Actually, ma'am, you can have you can take a pad. You can take a cotton pad. Above that, you can keep a gauze, and you can you can heat a little bit of oil, and whichever oil, like we basically use Bala Ashwagandhadi Taila. So you can have that. You can just make it warm, and you can immerse that cotton pad into that oil, and you can keep that cotton pad over the area, like over the penis and the associated that area completely. You can keep the pichu, and you can reheat the pichu every 15 minutes, or you can just pour a little bit of warm oil over that and keep it for almost 45 minutes.
Okay, okay. और मैम आरोहण मात्रा जो बस्ती बोला, मतलब इनिशियली हम तो 50 ml से जो मात्रा बस्ती के तौर पे देते हैं, 50 ml से स्टार्ट करते हैं।
Yes, ma'am. You can give up to 75 ml or 90 ml as well. 90. Sneha Vasti.
Okay, have to add 5 to 10 ml per day.
Yes.
Okay. Oh, thank you so much, ma'am. Thank you so.
Excuse me, madam.
Yes, ma'am.
Hello, Kamini madam.
जी मैडम, वेलकम
Namaste,
मैडम,
sir.
you can add on something
I'm there
if you
with
want.
thank you. And Radhika was my student. Radhika presentation was good.
Thank you so much, ma'am. Thank you.
I heard completely.
But
I heard. Nice.
madam, I found out your student. You didn't mention.
Thank you, ma'am. You find out because she got 2-3 times. She got paper presentation first place in paper presentation.
Okay, nice.
Her
nice.
presentation was good, madam. Even in the seminars, we
Yeah,
it is nice. Collection
excellent
was
work.
nice. Presentation was nice, Radhika.
Thank you.
Nice.
Thank you
Yeah.
so much, ma'am.
That
Very
no.
proud.
Pichu, you told no, Radhika. Just on gauze piece, apply that oil and all. Let it be wrap around the penis. That also good. Like lukewarm oil and all.
Okay, ma'am. Okay.
That I didn't tried here actually. I didn't get such a case, erectile dysfunction case. But before long back I got, and with the counseling actually it become good without treatment. It was corrected fortunately, and and the lady was conceived. That is the actually plus point with the counseling only. Now I didn't try this treatments actually, erectile dysfunction treatments.
I'll surely try this, ma'am.
The nice presentation, Radhika. Okay, nice presentation. And even I have one doubt that Jatifala you told it is means I'm not satisfied with that answer. Jatifala you told 7-8 days you have to give like that he told, but before coitus how many hours before and all they asked since.
Actually, ma'am, I have not practiced like just before the coitus or like that. I have not practiced. I have practiced in this such a way that I have given this continuously for. I have asked the patient to take it for 1 month, but after I think after 8 days, 8 days or 9 days, the patient told me that he found it very useful. So I got to know that with use of this Jati Phala for 7 or 8 days continuously is giving very good result.
Okay. Good. Because you don't know, that's why even I got doubt.
Yes, that work upon manobhava, madam.
Yes.
Definitely, that counseling is that much important than all these medication.
But Jaifal also work upon
Anyhow,
manobhava.
good luck,
No?
Radhika.
Yeah.
Thank you, ma'am. Thank you.
Yeah, there is gut-brain relation, so
Yes,
may
okay, ma'am. Thank you.
Yeah. Okay.
Yes.
Okay, ma'am.
Okay, ma'am. Thank you.
Yeah. Anyone want to add on or ask the question? We can take up 1 or 2 questions.
Hello.
Yeah.
I want to that Ahoratra Basti some explanation. I want Ahoratra Basti. She said no. Yeah.
Actually, it is told in Charaka.
But how you apply that?
Ma'am, we used to do that. We used to conduct 3 times Basti in 24 hours. So maybe we used to give.
How much time is consumed for that 15 or 20 ml oil or Gruta push?
Yes, ma'am. Actually, we will push almost 10 to 15 ml at the first stage, and we will. It takes around half an hour to do the procedure, and after that we will leave the patient, and the patient. Sometimes the patient will pass while he is passing the urine, some amount of oil goes off. But when we are inserting the catheter next time, we can see that the almost the oil has completely absorbed. We won't get the oil in the next cycle.
I know. Yeah, but after in 24 hours you give that 3 basti.
Yes, ma'am.
3 times. Okay, that is Ahoratra you said.
Yes, ma'am.
Okay. Nice presentation. Very nice. Good.
मैम मेरा इससे आज के टॉपिक से थोड़ा सा मिलता जुलता सा थोड़ा क्वेश्चन है। 2nd ग्रेड वेरिकोसील का कोई एक्सपीरियंस है? मैंने वैसे तो ग्रंथि लाइक एक 17 years old बॉय है, वो जिम की वजह से आघातजन्य ही है उसको, ये, और मैंने उसमें थोड़ी शोथ चिकित्सा और ये सोच के वात का आवरण हुआ पित्त के द्वारा, उसमें थोड़ी शोध चिकित्सा थी, पुनर्वादी कषाय, वरुणादि कषाय, त्रिफला गूगल और थोड़ी अरस टाइप की चिकित्सा, और प्लास पुष्पासव का जो कुआथ बना के उसको बांधने के लिए दिया था। इतना अच्छा रिजल्ट नहीं मिला 2 मंथ की चिकित्सा के बाद। किसी का कोई एक्सपीरियंस हो तो प्लीज शेयर करें।
May I?
Yeah, sure.
Actually, sir, I am having a small experience with treating with varicocele grade 2 because we are giving Sahajaradi Taila Anuvasana Vasti as well as we are giving Sahajaradi Taila Pana. So when we are giving Sahajaradi Taila, we are using Avarti Tailas. Almost for 7 times Avarti Tailas we are giving for intake, and we are giving along with Chiruvilladi Kashaya, which has shown good result in grade 2 varicocele, as well as we have given Kati Avagaha along with the treatment protocol. And Vrishyavasti or Vajikarna Vasti is very much beneficial in such cases. We have received good result with that, sir.
मैम अवगाह में कुछ द्रव्य डालने हैं जैसे 10 मूल वगैरह कुछ, या वैसे सिंपल पानी का?
Sir, Dashamula is having good results, sir. Or Erendamula boiled in water.
मात्रावस्थी मैम मैंने दिया था सहचर आदि के साथ उसको 20 डेज कंटिन्यूस।
Okay.
50 ml का डोज दिया था, पर कुछ रिजल्ट मिला नहीं, सेम ही है, बड़ा भी नहीं है और कम भी नहीं हुआ।
Sir, maybe you can try, sir, try with Arohana Matra, because at first in my practice I used to give only the same amount every day, but later on we started just trial. We started for Arohana Matra, but we found that it was very much effective, like up to 120 ml we were giving Matra Basti, and it was showing good results, sir. Maybe that might help, sir.
ओके मैम, थैंक यू। और किसी का कोई एक्सपीरियंस हो तो कामनी मैम प्लीज एक बार पूछे।
जी रामवीर सर अगर हैं तो वो बता सकते हैं इसमें कुछ। हमारे पास निशांत जी है, निशांत जी भी बता सकते हैं उनके पास अगर कोई एक्सपीरियंस है इसका। रामवीर सर, इसमें आपका एक्सपीरियंस है क्या वेरिकोसिल?
जी मैम, इसमें कोई मेडिसिन का कोई इस तरह का नहीं है। मैं इस तरह के पेशेंट आते हो मैं निश्चित ही सर्जरी के लिए रेफर करता हूँ।
ठीक है ठीक है ठीक है ठीक
जी
है
मैम।
ठीक है। और कोई निशांत सर?
हरिओम।
हाँ जी।
आखिरी कंक्लूडिंग रिमार्क्स चलना है कि क्वेश्चन आंसर सेशन अभी और चले?
क्वेश्चन आंसर चल रहे हैं अभी।
बहुत अच्छा बहुत अच्छा, अभी समय है 10-15 मिनट का।
क्वेश्चन आंसर ही चल रहे हैं अभी,
आप
बस अभी
बढ़िया
एक सवाल
कर
के
रहे
बाद
हैं।
10-15 मिनट का समय अपने पे है मैडम।
एक सवाल के बाद कंक्लूडिंग ले लेते हैं अगर नहीं है क्वेश्चन तो, है ना?
आराम से 15 मिनट है अपने पे, आराम से 10 सवाल ले सकते।
जी 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 जी।
एक ऐड कर देता हूँ मैम, एक चीज और कर देता हूँ
जी
इसमें।
जी।
इसमें इरेक्टाइल डिस्फंक्शन के अंदर दोनों के अंदर जो बॉन्डिंग है ना पति पत्नी के अंदर, वो बहुत बड़ा रोल अदा करती है। चाहे कितनी भी काउंसलिंग कर लो, मगर घर के अंदर अगर शांत का वातावरण नहीं है और काउंसिल के बाद में भी बॉन्डिंग नहीं हो दोनों के अंदर, मुझे लगता है कि काउंसलिंग दोनों को ही करनी चाहिए, पति पत्नी को दोनों। मैंने ज्यादातर पेशेंट के अंदर ऐसा देखा है, जो पेशेंट्स मैरिटल डिसर्मनी है जिनके अंदर, या फिर वो अपने आप को इन्फीरियरिटी कॉम्प्लेक्स रखता है अपने आप में पेशेंट के, इन्फीरियरिटी कॉम्प्लेक्स वाले जो पेशेंट है उनके अंदर काउंसलिंग भी काम नहीं करती, मेडिसिन भी नहीं काम। तो मेरा ऐसा मानना है कि दोनों पति पत्नी का ही काउंसलिंग करना चाहिए, और एक दूसरे को स्वीकार करना और एक दूसरे को सुपीरियरिटी बताना, ये थोड़ा सा उसके अंदर मैंने देखा नेगेटिविटी लेके आता है। इसलिए पेशेंट में किसी तरह का रिजल्ट नहीं मिलता जब तक दोनों पति पत्नी का काउंसलिंग ना करें। और एक पहले भी मैंने बात की थी, काउंसलिंग जब ही रिजल्ट देती है जब पेशेंट का आपके ऊपर फेथ होता है। फेथ तो नहीं होगा तब तक कितनी ही काउंसलिंग करें तब तक रिजल्ट नहीं मिलता। तो पेशेंट के फेथ जीतने के लिए पूरी तरह से उसका एग्जामिनेशन करना और पूरी हिस्ट्री लेना, ये बहुत जरूरी है, ऐसा मेरा मानना है।
रामवीर जी, भाई जी,
हाँ
मैं
जी
भी
भाई।
बोलना चाहूंगा इस विषय में। मेरी एमडी इसी सब्जेक्ट पे है,
आई नो
इरेक्टाइल
आई नो।
डिस्फंक्शन पे ही।
जी
और
हाँ जी, मुझे पता है।
अष्ट संस्कारित रस सिंदूर का मैंने ब्रश योग बनाया था, और 30
जी
साल
जी।
कलकत्ता में इसी की प्रैक्टिस की। मैंने ये
हाँ
देखा
हाँ।
पति पत्नी में यदि दूध में नींबू पड़ गया, माने समझ लीजिए खत्म हो गई बात। आप कितनी भी काउंसलिंग कर लीजिए, मन में ऐसे दो विचार लेके आते हैं, अलग अलग यदि काउंसलिंग करते हैं। और करोड़पतियों में ये ज्यादा प्रॉब्लम है, गरीब बेचारा सब
हाँ,
एडजस्ट कर लेता है। जितनी पैसा आता है उतनी ईगो आती है, और इरेक्टाइल डिस्फंक्शन ज्यादा होता है। ये
वही
मेरा
मैंने
मानना
कहा, आपकी आपकी बात को मैंने उसी चीज को रखा
जी।
कि ये दोनों का काउंसलिंग जरूरी है। मेडिसिन ज्यादा काम नहीं करती, काउंसलिंग भी ज्यादा काम नहीं करती। जब दोनों एक दूसरे के अंदर निश्चित ही इन्फीरियरिटी किसी के अंदर नहीं आनी चाहिए। दोनों में से इन्फीरियरिटी अगर बच्चे उसके अंदर, पुरुष के अंदर आ गई, कोई मेडिसिन नहीं काम करेगी, कोई पंचकर्म नहीं काम करेगा, ऐसा मेरा मानना है। तो उसके अंदर अपने काउंसलिंग के द्वारा दोनों को इक्वलिटी लानी चाहिए, ऐसा मेरा मानना है। थैंक यू।
सर मेरे पास तो सर ऐसे इनफर्टिलिटी के पेशेंट्स आते हैं तो उनमें बताना पड़ता था। मैं तो खैर फीमेल पार्टनर को ही थोड़ा बताती कि थोड़ा माहौल बनाओ, तुम घर जाके रूम सजाओ,
बिल्कुल बिल्कुल
रूम
बिल्कुल।
सजाओ, कैंडल लगाओ, एरोमा कैंडल लगाओ, ये करो वो करो, ऐसे से
मैडम
थोड़ा
ये
उनकी काउंसलिंग कर देती हूँ।
ये अद्रव्यभूत चिकित्सा ज्यादा काम करती है, मेरा सामान।
हाँ, थोड़ा सा मैं ऐसे बताती रहती हूँ फीमेल्स को,
जी
बाकी
जी
तो हाँ।
जी जी मैम, बहुत अच्छा।
मैम मैम काम की भाग दौड़ में ना मेंटल प्रेशर बहुत ज्यादा है। आहार विहार लोगों का सही नहीं है, निद्रा कम, प्रॉपर नींद नहीं लोग लेते 4-5 घंटे से ज्यादा, साउंड स्लीप नहीं होता, ये भी इसका एक बेसिक कारण रहता है। और इसमें जैसे
वो
शिरोधारा का
भी
बहुत अच्छा रोल है।
नहीं, वो भी तो हमें बताना पड़ता है ना उनको। मेरा तो क्या थोड़ा तरीका ही अलग हो जाता है। मैं बोलती हूँ पैसा कमाना किसके लिए है आपको? जिस पैसा पैसा कमा के ही अपना शरीर खराब करना, तो उस पैसे की जरूरत क्या है? ऐसे ऐसे थोड़ा थोड़ा मैं काउंसलिंग करती रहती हूँ ऐसे।
प्रॉपर धातु अग्नि की वजह से ना शुक्र का वो नहीं हो पाता, वहां तक पहुंच नहीं पाती हमारा, ये बड़ा रहता है।
हम्म। मतलब ओवरऑल सारे फैक्टर्स पे हमें काम करना पड़ता है, तभी जाके रिजल्ट मिलता है ना। हम्म। ठीक है, अभी क्वेश्चंस नहीं है तो वी कैन हैव कंक्लूडिंग रिमार्क्स फ्रॉम अग्निहोत्री सर एंड देन वी कैन कंक्लूड दिस सेशन। अग्निहोत्री सर, ओवर टू यू।
ओके, थैंक यू मैम। सबसे पहले तो हम आपको बहुत बहुत बधाई देना चाहेंगे कि आपने आज फिर एक अपने नए हीरा से हम लोगों की भेंट कराई।
हीरे
और
छांट
ये
छांट के लेके आती हूँ।
जो आप कहते हैं वो सच्चाई है। और हीरा को भी हिंदी आती होगी, नहीं तो हम इंग्लिश में शिफ्ट हो जाते हैं। तो इट्स रियली आवर ग्रेट प्लेजर दैट दिस प्लेटफॉर्म हैज बीन ornamented with the help of your kind support and projected Dr. Radhika in form of a very good Hira. And again, we are all seeing that why can't you see her forehead? Her forehead is the informer of the class of intelligentsia. The way she presented it, it seems that it's a plus 4 angle. I think there is no wordness. This is what the built-in forehead shows the class of intelligentsia. Well, commenting upon today's topic, it's very important, and I would like to go for the Adabhut Chikitsa. And very honestly, in fragmented form, I got so many things, of course, from Dr. Ramveer Singh also, and other person, Dr. Pawan also. The fact is a little bit different. If I say, being a male and having almost 36 years experience treating, getting the informations and complaints of the both partners, I feel that it's a privilege of males to have a good erectation. At the same time, I should say it's a luxury for a male. But if it goes down, if he is a married one, the wife itself is maybe a cause of erectile dysfunction, at the same time maybe the treatment of erectile dysfunction. This is what I want to present. So both persons are supposed to come, and they both are supposed to be well given the counseling and the tips for that. As you told that there should be some aroma, some sort of atmosphere, rather I should say conducive atmosphere. But at the same time, the role of foreplay is wonderful. It is not necessarily necessary for every time that there should be a penetration and there should be a complete intercourse. But there should be a good desire in a form of libido. There should be a good understanding for the each and every comfort of both the partners. Of course, the sitting, the bed, the room, the environment, the light music, the light, the low-graded light, everything, how much conducive both are and taking care in this connection. The ultimate is a far off place or far off put situation. Everywhere you are not going to have the treatment part to manage the things, because then it will be simply a sort of mechanical work, as Dr. Sharma told that it's not a science, it's an art. And I do agree with it, because intercourse or the sexual intercourse itself is not an act, it's a play. And when it's a play needs some sort of, say, presentation, good procedure, because you will get the clapping only then when the play is well depicted on the, say, stage with the help of the, say, all the artists. This is what we are supposed to do, because it's a very personal thing. And when the things are open today on my platform, it's a fact, because persons are coming of any age groups starting 25 or 28, that I'm not in position to do anything on the bed. But at the same time, if the wife complains like this, definitely the male will go in depression. And if wife is supportive to say, well, it is this time it is not happening properly, I am with you, and I am wait for the chance when you will be a good performer. So these things are interrelated within the male and female, which amounts in a form of the keeping the medicines away and enjoying and encouraging the psychological effect and the cooperativeness on the, and the I should say the understanding within both the partners. That leads wonderful, because I have seen so many cases, especially when the person is coming late, or is an alcoholic, or so many things. I smoke, is any smoker. Things are ruining down as far as the performance is concerned. For of the time when he may be enjoying the proper this erectile status. So for that, it's a female who can manage very well. That because I am yours and I want a good satisfaction from you, and that could only be possible when you will become a good performer. So by that, I am with you. You needed to go for any depression, you needed to go for any anxiety. I'm with you, and I appreciate you when you make efforts to go for the better performance. So these are the things which are equally important as the medicine is. So it's a wonderful presentation today, and you covered, Dr. Radhika covered all the sections, but the full life is there for you. So every time, with medicine, without medicine, but the counseling and frankness regarding the persuasion of the issue. And of course, you cannot go for the same treatment to every patient. That's why you have to go for the etiological factor. Persons are usually hiding the factor that they're easily not going to accept that, well, I am not a good performer, or I am not having the things up to the mark. So for that, you have to peep into the matter and then take out the real hidden facts, and then it will be very easy to manage the. Of course, for male also, no question. When our doctor is there, irrespective of gender, she may well define, and of course, both the persons is there. And for this, it is a wonderful process. You just take all the complaints from the wife, and then again from the husband, and ask them that whatever you are telling about her or about him, be dareful that I would like to inform to both of you in front of you, single counseling, wife, husband, and then combined. It results like anything. Then so many things are which are hyperbolic may not be effective, and then they usually converge to a point that, well, we will manage, we will restart our life, and definitely situation will alert. So by that time, such type of psychological disorders would have gone away, and they would have gone warded off, and the situation will be most submissive, most reliable, and most full of performance. Thank you so much for presenting such a nice topic. Of course, topic related to male and female equally, and of course, our platform is of course indebted with your presence. Thank you so much. you and Professor Kamini. नमस्कार.
नमस्कार. थैंक यू सर फॉर नाइस कंक्लूडिंग रिमार्क्स. आपने बोला था, मुझे लाइट का याद आया कि रिसर्च हुई थी, उसमें एक स्काई ब्लू कलर लाइट का भी इसके ऊपर रोल बताया है कि रूम में स्काई ब्लू कलर है और स्काई ब्लू कलर की लाइट है, पेंट स्काई ब्लू कलर का कराया जाता है. ये भी थोड़ा सा उसमें जो है
लाइट पिंक कलर अनुराग का
Sky
प्रतीक
blue.
है, रेड एंड पिंक. या
हाँ, इसमें
सर,
इन
चरक
टाइप के केसेस में स्काई ब्लू कलर बताया गया है.
स्काई ब्लू, कंडूसिव टू द आईज.
जी
आज
जी जी
आचार्य चरक ने स्त्री को परमबाजीकरण इसलिए कहा है कि जो भी
जी,
ट्रीटमेंट है उसी के द्वारा होता है.
जी
नंबर
सर.
2, एक ट्रीटमेंट रह गया सर, मैं उसको भी बता देता हूँ. चरक ने जो सहृद मित्र हैं उनका साथ भी इसके लिए कहा है. स्त्री के लिए नहीं, साथ में उन्होंने सहृद मित्र हैं उनके द्वारा भी इसका ट्रीटमेंट है. तो जो सेक्सुअल डिसऑर्डर है उनमें सहृद मित्रों का भी बहुत बड़ा रोल रहता है, उनका भी साथ बहुत जरूरी बताया है. अलग अलग जगह पे उन्होंने विभिन्न मित्रों के क्या प्रकार होते हैं उनका वर्णन किया है. मदाध्याय में जहाँ पे वर्णन किया है वहां पर इस तरह के मित्रों का वर्णन किया है जो अपने सहृद होते हैं और उनके अपने सेक्सुअल डिजायर वगैरह की बढ़ाने की उनसे काउंसलिंग की जा सकती है. थैंक यू सर.
Okay, thank you. So we will now conclude this session. Thank you, Agnihotri sir, Rami Sharma sir, and our today's star of the day speaker, Dr. Radhika. Congratulations and thank you very much for enlightening all the participants. Thank you so much. Thank you. Thank you all.
थैंक यू आवर गेस्ट स्पीकर्स. एंड रियली आप मुझे खुशी हुई कि आप इतनी अच्छी तैयारी से आते हैं. आपकी पढ़ाई अच्छी है, मॉडर्न एस्पेक्ट आपने बहुत से टच किया. लगता ही नहीं कि आज के बच्चे मेहनत नहीं कर रहे हैं, अच्छी मेहनत कर रहे हैं, अच्छा प्रेजेंटेशन दे रहे हैं. रियली इट्स अ प्राउड मैटर फॉर अस. Thank you so much, and I really appreciate all the presenters and the participants today who joined our platform this evening. Thank you so much. And over to Professor Pawan Sharma ji for changing the link for the next webinar. Professor Pawan Sharma ji. Professor Pawan Sharma ji, ये वाली वेबिनार हम लोगों ने कंक्लूड कर ली है और नेक्स्ट वेबिनार के हमारे गेस्ट स्पीकर्स, एक्सपेक्टेड गेस्ट स्पीकर्स आ चुके हैं. तो आप इसको चेंज करिए तो अपने नेक्स्ट वेबिनार के स्पीकर्स को इनवाइट कर सकें, उनको हम वेलकम कर सकें. डॉक्टर प्रोफेसर पवन शर्मा जी, कहीं वो डिनर में नहीं चले गए हो, बिकॉज क्लोजिंग एंड चेंजिंग इज इन देयर हैंड. एंड आई थिंक प्रोफेसर पवन शर्मा जी, हम लोगों ने ये अपनी इरेक्टाइल डिसफंक्शन वाली वेबिनार कंप्लीट कर ली है, कंक्लूड कर लिया है. आप नेक्स्ट वेबिनार के लिए चेंज करिए, फोन करना होगा. तो हमारी इस वेबिनार में हम लोगों ने बहुत अच्छे इंफॉर्मेशन मिली हमारे गेस्ट स्पीकर्स के द्वारा, मैडम कामनी धीमान जी के द्वारा, कि एक बहुत ही कॉमन सी प्रॉब्लम जो कई बार बिना किसी की गलती से हो जाती है और उसमें थोड़ा सा काउंसलिंग भी बड़ा हेल्पफुल होती है और हमारी सोसाइटी को, हमारे परिवार को डिस्टर्ब होने से बचाती है.
हरिओम.
हरिओम. हरिओम.
कटियार, डॉक्टर सी के कटियार.
हाँ हाँ, हमने देखा था. अरे जय हो, जय हो. बहुत शानदार भाई, मजा आ गया. अच्छी भेंट हो रही है, अच्छी मीटिंग हो रही है. मैं दोपहर में आपकी फोटो भी देखी जो आपको इन्होंने फेलिसिटेट किया, बड़ा अच्छा लगा.
था झांसी में.
हाँ वही तो. अभी आप स्क्रीन पे नहीं है. दोपहर में अरे अपने मायाराम मुनियाल साहब भी आए थे. गुरुदेव वो भी आए थे. बहुत अच्छा लगा इनकी मीटिंग. बहुत ही अपने लाइफ इसमें हैट्रिक कर रहे हैं वहां पवन शर्मा जी, लेकिन इसके बावजूद जो है डटे हुए. वीर तुम बढ़े चलो की तरह
यहाँ भी नहीं छोड़े, यहाँ भी लगे हुए.
यहाँ लगे. अरे देखिए ना, उन्हीं बदौलत रन कर रही है. और सब बढ़िया है.
बिल्कुल बहुत बढ़िया.
चलिए, बहुत अच्छा लगा, बहुत अच्छा लगा। मैंने देखा अभी आप उस समय भी, अभी थोड़ा लाइट बैकग्राउंड से आ रही तो बहुत डिम आ रही है। चलिए, वाह वाह वाह, बहुत सुंदर, बहुत सुंदर।
केवल 1 मिनट लगेगी।